Pets Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
And a very good morning to you, and a very good morning to Des. Hello, sir. How are you?
Good to be here, thanks.
Oh, sorry, but it helps if I put up your microphone, actually, to be fair. How are you today?
Yeah, good, John. Not a bother, thanks. Cold out there today, but look, it's brighter and the days are a little bit longer, so fingers crossed spring is in the air.
Yeah, and before we go any further, did you enjoy the rugby all across the weekend?
I did. It's very interesting. It's great to see young players coming along and playing so well. Big shout out to the boy from Kildare, young Sam.
Yeah.
He's growing into a fabulous player. He's a pleasure to watch.
Yeah.
The Irish team did really well.
Yeah.
They looked really good in places. It was an exciting match against Scotland. And you know, Scotland weren't that bad.
Yeah, absolutely.
They could have...
hard to think a few years ago, just around before COVID, Sam was playing for Newbridge, huh?
Yeah, it's hard to believe he was in a Newbridge College jersey just a few years ago.
Oh, I know, it's mad, isn't it? And you see where he's at now. He could be playing 10 in the Lions yet.
Yeah, we could have an argument about that.
Yeah.
Like if he progresses another little bit, he'll be in contention. Yeah. My 3 Lions 10s at the moment would be Finn Russell, Marcus Smith.
Yeah, and Finn Smith probably.
And Finn Smith. Yeah. But Sam is thereabouts now at this stage.
I'll tell you, if Leinster make it to the final and he's playing, it'll change.
Yeah, it'll change. Like, he'll get all the experience. But the speed he's progressing is fantastic.
Yeah, it is, yeah. Right, matters at hand. From rugby, we turn our attentions to animals and animals dentistry, because I would say that every week we always get a question about gums and teeth and everything else. In simple terms, why are we talking about dentistry today?
Because we can do a lot in the veterinary world now for the teeth of the various species that we look after, and we have discovered over the years that good dental hygiene and good dental health in animals and any procedures or interventions that we can do on the dentistry side make a massive difference to their well-being, their quality of life, their longevity and their overall long-term health. So dentistry is an area where we can do a lot of good. And we can see a lot of long-term benefits. Okay.
When it comes to dentistry as a rule, it affects animals, predominantly dogs, I presume. They're the ones that have the biggest issues?
Yeah, we see cats, yes. Dogs have the biggest issues because obviously they use their teeth, they chew a lot. They're descended from a scavenging and a hunting dog, so they're very reliant on their teeth. They do develop dental decay, toothache and bad oral hygiene as they get older, and this can cause them to lose their appetite, lose weight, be in pain with toothache and so on. So toothache and bad oral hygiene can seriously affect their quality of life, and when we fix up an older dog's mouth, it makes a massive difference to their well-being and their temperament. Even people will say he was getting a little bit contrary, he was cranky, he didn't like being petted and so on, he was head shy, and now he's a different dog again after having the bad teeth removed.
Okay.
So very discernible, noticeable differences.
Okay. Now, I saw a stat, and it was an interesting stat, and it was based on an Irish group, and it was, did you know that 85% of all dogs and cats over the age of 4 years old have some form of periodontal disease?
Yeah, that's true. Whether it's toothache, if it's affecting them or not. You see, they'll have cracked teeth from playing with stones and sticks and so on. So that sort of wear and tear is normal. And cracked teeth, eventually you get exposure of the pulp cavity, and eventually they have to be removed or cause toothache. You'll have retained deciduous teeth, which are the baby teeth that don't fall out. They'll eventually cause food matter to gather between 2 teeth, and then you'll get a root canal infection. Third thing that can happen is you can get gingivitis or inflamed gums because of infection, and then that'll affect the roots and you'll get periodontal disease. It can be low grade and progressive. And then for the human element of periodontal disease, in terms of remembering these animals now live indoors with us, they're breathing on us all the time inside in the house. Remember I pulled out a shock horror story a few weeks back about a man in the United States who got a horrible flesh-eating bacterial disease from being licked in the face by a group of dogs. Just playing. He was actually swimming in a swimming pool with dogs.
Right.
And he picked up this bug similar to MRSA from their saliva.
Why?
And he nearly died.
Yeah.
Lost lost two of his hands and feet, I think.
Wow.
Fasciole, we all heard of this necrotizing fasciolitis.
Yes, right.
Which is the bacterial infection that gets in under the skin and gets into the bloodstream. So he got a version of that from dog saliva.
Wow.
So they carry all kinds of nasty bacteria in their mouths, which are harmful to us. So making sure that they have good oral hygiene it has a knock-on benefit for human health, and the best way to gauge whether their dental health is good enough is, do they have halitosis or smelly breath? So, smelly breath is a cause for concern.
Is it advisable nowadays, because the way dentistry in animals has progressed so well in a positive way, is it more advisable to be preventative rather than reactive?
Yeah, so preventative, yes, prevention. Well, prevention is better than cure in most cases.
But most people, to be fair, Des, most people, animal owners, don't go with the preventative.
No, they don't look inside their dog's mouth.
No,
until they feel they need to.
Yeah.
And they probably should, from an early stage, get the dog used to having his teeth examined and used to even having his teeth cleaned.
Yeah.
There are brushes that can be used on dogs, but a very simple way to make sure that their dental hygiene is good and that their teeth are kept clean is just give them lots of things to chew, and then you won't get a gathering and a build-up of tartar to the same extent. So they are scavengers, they say, they're hunters. They have all of these big teeth in there for crunching and munching on bones, so that means that they should have lots of really strong chewy objects to help keep their teeth clean. So that's the single best way to prevent. Second way, equally good way, dietary. Less soft food, less sloppy food, more hard food that they can chew and break up.
Yeah, what type of... So we know from your advice always that it will stay on dry food, because that will probably help you going forward, would it?
Yeah, I like kibble, and as I say, on a convenience basis, that it's easy for you to get a complete diet and to know that you're giving everything to your dog that you should give. If you buy a premium complete dry diet, you'll know they're getting the best of everything, so you have that peace of mind. Also with the kibble, there's the chewing process there and the crunching, and they're helping to keep their teeth clean. Lastly, with the kibble, the fact that the balance is there and it's high fibre, their stools will be solid, their digestive system will function properly.
Okay, right. Pádraig Krazani says he's got a 7-year-old red setter in absolute cracking form. His coat is so well, but when we open his mouth in recent times, there is a terrible smell. He seems to be eating grand, no problems at all. But if there is a terrible smell, is that a sign of something?
Yeah, it's a sign of something, no doubt. It's a sign of probably plaque and tartar build-up at the back teeth, the ones you can't see.
Okay.
So do try and have a look further back, and if you see a level of brown staining there on the molars, then it's an indicator that some dentistry might be needed. And he's the right age to do it, because we usually have to give a general anaesthetic to do anything significant on the dental side, let's face it, in dogs and cats. So while he's 7 or 8 and he's not too old, he's a good, safe candidate for a general anaesthetic.
Okay, 6 steps to keep your pet's teeth healthy. Right, I just Googled this just a second ago back. 1, food deposits are a major cause of bad breath. And bad teeth as well. Subsequent ill health. Minimising food deposits is an essential part of looking after your pet.
Good.
Okay. 2, ensure your pet is only fed once or twice a day. Right, Des, what about that one?
Yeah, that's a good one. If you get them to eat for a good 5 to 10 minutes and spend that sort of time over their food, have a good big solid meal.
When is the best time to feed your dog?
12-hour intervals.
Yeah, I mean, you're talking about in the morning.
The old-fashioned recommendation used to be 1 meal a day in the evening, at night.
Yeah.
And nowadays, puppies are fed 2 to 3 times a day. So I think it's a good thing to have your adult dog in the routine of having their food split AM and PM. 7 AM and 7 PM. That's when we feed our dog, and she does well on that.
And what do they do? Do they survive just on snacks or anything, maybe tween, or are they just left to
shouldn't have snacks,
really,
shouldn't need
but
it.
Do they?
No. I look at people give snacks and
come on, you're a vet that probably spoils Bonnie.
I do spoil Bonnie, but I think training treats are probably okay, providing they're firm and they're crunchy. But we use her own kibble for training as training treats, a handful or a small bag with us when she's out for a walk to help with recall. So if they're used to eating their own kibble is perfectly suitable to use as a treat.
Okay, Maura was on. She says, guys, I think the advice you're giving is absolutely spot on. I went to a vet recently and he said the problem with your dog is he's eating intermittently all the way through the day. He advised that come around 5 o'clock or 6 o'clock in the evening when the family are sitting down, after he's finished eating his food, take up the food that isn't eaten. Yeah,
that's correct. We do say that too. Snacking is not actually good for them. And on a convenience level, I'm all about trying to make sure that the dog fits into your lifestyle and fits into the human household as easily as possible. Dogs have to navigate the human world, and it has to be an easy job of managing the dog and not a difficult job. So one of the ways to ensure that their digestive system is regular and they need to pass stools at predictable regular intervals is by feeding them at predictable regular intervals. So overfeeding and snacking will cause their digestive system to be on overdrive all day. They'll gain weight and they'll pass stools randomly at different times. Therefore, training, particularly with younger dogs, house training becomes more difficult.
Okay, now next one. When it comes to using the toothbrush, Des, dogs that are younger dogs, that's probably easier to do than a dog that's older because he won't let you go near him.
Yeah, no, you won't get it. That ship has already sailed if your dog is 1 year plus. It's a good thing to start with puppies. Use the brush. You can get them in pet shops.
Okay.
For the older dogs, I just advocate the nice, non-destructible, really solid toys. And the other thing that's good is these big bowls with the bumps and lumps into them, so the dogs eat slowly and chew better. They're really good.
What about bringing your dog to the vet to get it professionally cleaned, like the likes of you guys coming out and doing it, or doing with the dogs? Do they go under anaesthetic, or what way would you normally, or relaxant, or what way would it be done?
Yeah, with regards to that, for the spring, right up through to the end of April, we're running free dental checks.
Okay, very good.
In our practice. That's to raise awareness about animal dentistry, and also it's because we've put in a new dental suite so that we have the facilities there. We'd like to show them off. We'd like to use them. So free dental checks on dogs or cats right up to the end of April. Now, with regards to if and when they need some work done, they do have to have a short anaesthetic because they have to go under. We have to put a device in their mouth to keep it open. We have to pass a tube down their airway so that saliva and water and fluid doesn't get down into the lungs. And then we use the exact same type of descaling machine and the drill bits and the whole lot as you see in your human dentist.
Okay, a couple of questions in. First of all, guys, is it easy to actually check your pet's teeth? And is there a couple of symptoms, or is there a couple of top tips you can give us just about basically checking your teeth?
Yeah, have a good look. First of all, just pull the lips back at the front.
Yeah.
And if your dog tolerates that and doesn't mind, and give them a bit of reassurance, and have a good look at the front ones, top and bottom, and have a good... The front ones, the small front ones, are called incisors.
Yeah.
And they should be clean. They should be as close to white as possible. Okay. Secondly, the bigger ones at the side that more or less kind of look like fangs, they're called the canines.
Yeah, yeah.
And there's 4 of those, 2 up and 2 down. And you should see the canines. And again, the canines should be pearly white.
Okay.
Go a bit further back, tease the lips to the side, open and lift the upper lips, and see can you have a look at the big rectangular and squared teeth at the back called the molars.
Right.
Again, they should be as close to white as possible. What you'll get commonly with those molars is build-ups of brown and black material called plaque or tartar, which is bits of food material that solidify because of the pH of the saliva causes these food deposits to solidify, and then they build up as plaque and tartar in between the molars and on top of the molars and against the gums. And those deposits of plaque and tartar become irritants, and they will cause the gums to recede. So when you get plaque as a build-up, first of all, it damages the tooth. Secondly, it damages the gums. It irritates the gums. The gums will recede, and you'll get gingivitis. And that leads to exposure of more tooth root, and therefore more tooth root damage. So these browny black deposits, they're not just cosmetic, they're causing damage to the tooth and gums.
Okay, we go to senior dogs. We have a Labrador who's 7 years old at the moment. I've been told that Labradors are one of those type of dogs that could end up with some dentistry issues going forward, including bacteria attacking gums.
Yeah, again, at 7 years of age, come in for a free dental check and let's have a look and see. An anaesthetic and a clean-up would be indicated. 7 is the right age. You see, if you get the clean-up done now, it'll probably prevent loss of teeth.
Yeah.
And later. And decay and gingivitis and all these awful things later, as well as sorting out the smelly breath, the halitosis at this stage.
Right. What about the actual general routine? In other words, are you meant to be checking your dog's dental welfare kind of 3 months a year, 6 months a year, once a year? And how often should you and would you recommend bringing your dog to the dentist to get checked out purely on a dental basis?
To be fair, it's probably sufficient to have a good look once a year and know where you are in terms of the overall dental health of your dog. That's something that any vet will do as part of the annual visit. Typically at the time of the vaccination, we do a bit of a check-up, we'll have a listen to the heart, we'll have a listen to the lungs, we'll have a look at the eyes, the ears and the teeth.
Okay, another question came out which I think is quite good actually. It's to do with our topic of last week when we were discussing pet insurance. Does pet insurance cover dentistry?
Doesn't cover routine dentistry. It doesn't cover preventative dental care. It'll cover surgical or interventionist dental care in later life. To an extent, if there's a disease process in there and work needs to be done. But typically dental wear and tear arising from the normal pattern of eating and living, insurance won't cover that, which is another good reason to keep on top of it from an early age, because when you get to 9, 10, 11 years of age, a general anaesthetic is required, probably dental x-rays, right? And there's serious damage there and serious dental disease. You could be talking 6, 8, 10 extractions.
Right.
That's 2 hours of veterinary work. X-rays included, medications during surgery, medications after surgery. Nowadays the bill for major work in an older dog will run from 600 to €1,000.
Okay, that's a lot. Yeah. Okay.
So keep on top of it for a couple of €100 once or twice in the dog's lifetime. From an earlier age.
Yeah, okay. Like the idea that it's dentistry, and when it comes to big operations and things like that, will actually be the long-term benefit of the dog or the cat. When it comes to dogs and cats generally, do they lose teeth often? At what ages are they talking about losing teeth naturally? They
lose their deciduous, they lose their baby teeth, and they fall out before a year of age. They don't lose very many adult teeth throughout their lives, no, unless there's trauma.
Yeah.
The incisors, firstly, will start to fall out in later life.
Okay.
But again, a little bit like humans, they tend not to fall out when they turn bad. They tend to linger in the mouth and cause toothache and cause infection, and we end up having to intervene.
Do you remember years ago you used to get the dog bones from the butchers and give them to them? Is that common anymore, or do we stop doing it?
I'd say for convenience sake and everything else, people have stopped doing it to the same extent. But the good family butchers, the likes of Nolan's and Kilcullen's and Paddy Burns and Kildare, you'll still get bones in the family butchers.
Are they good for the health welfare for the teeth?
They should be cooked. They should be cooked though.
Yes.
Raw bones will splinter and crack and can cause damage to the mouth, the esophagus, the digestive system.
It's raw meat as well.
It's raw meat as well, which isn't. So you have the bacterial element of it on the bone, which mightn't be that fresh, and you'll end up with maybe gastritis, enteritis, diarrhea, tummy infections, and if the bone splinters, you'll be in trouble. Your dog will be in trouble in terms of damage to the digestive system or the mouth. So you should cook them. And as far as I remember, Nolan's Kilcullen actually still do sell bags of cooked bones for dogs.
Do they?
Yeah.
Very good. I'm sure if the lads out there are listening, they can message into us, or if anybody else is out there, we'll give you a bit of a mention. If you do that, we'd love to hear from you. Is it good for dogs though?
Are they good for them?
Yeah.
Sure. I'll tell you, nowadays, a lot of our little family pets tend to be quite sensitive. The cockapoo, cavapoo types, the ones with poodle pedigrees in them.
They want steak.
They generally have sensitive digestive systems, and a lot of them end up on a sensitivity diet or a hypoallergenic diet. They don't tolerate a lot of the random ingredients that you might think are okay for them, They're not as resilient and robust as the old yard dog used to be years ago. So they might love an old bone like that, but the chances are it's going to cause a bit of diarrhoea, bit of gastric upset, bit of bloating. So, as I say, not necessarily good for them unless they're used to it, and definitely unless the bone is cooked.
Okay, good stuff. Good, great topic today as always. Anything else you want to mention?
How many teeth do you reckon a dog has?
Oh, well, adults...
Quiz.
I don't know.
They have 42.
I was going to say about 30 or 40.
They're 42. How many teeth do you reckon a horse has?
52.
No, up to 44.
Go on.
There you go, 44. Now, cats have only 30.
Right.
Yeah, you would think they'd have more. But... and they lose them as well as they get older.
Right.
And they get just as much dental disease as dogs, believe it or not. Yeah.
Okay, right.
And by the way, the Donald, the Trump man, one of his latest pronouncements.
How many teeth is he?
How many teeth has he got left? Yeah, I wonder. Yeah. So the latest pronouncement he came out with is about reinstating plastic straws. And he says, look, those paper straws are no good. Paper straws are no good. He says, I hate paper straws. You try and drink a hot drink through a paper straw and it melts. It's terrible. It's not good for anybody. So we're bringing back plastic straws, he says. Yeah. And by the way, he says, don't be worrying about the sharks. They're well able to digest a bit of plastic as they munch their way through the ocean.
I know, yeah.
God help us.
I tell you one thing, and I've seen it before and I've heard the conversation about the paper straws in the pubs. What he said about paper straws is not the world's worst comment from using perspective.
Yeah.
I know from the environment perspective it's a different matter. But from using perspective, I don't even use them anymore. If I go into McDonald's or Burger King or whatever the case may be, when it comes to those straws, I don't just use them. I'm not criticising them. I don't use them for that probably the same reason.
No, they're awkward.
It's just filthy paper.
They are. I laughed when I heard it and I just thought I better say to people, folks, plastic straws are a disaster for dogs.
Yeah, absolutely. Okay, well done. Great stuff indeed. That's Des.
Great, John, thanks.
Pets Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
Yeah, thanks to Des there, and that episode of A Pet's Life, all about dental and matters when it comes to your cats and dogs, will be going up on our social media account a little bit later on the podcast service. You can find it there.